be talking about employee lifestyle disease management intervention solution. So a bit about HealthJunction, which I mentioned earlier. We are a biometric health screening company, but we also specialize on wellness programs. And obviously, we work with all the team members that you meet them. I go straight to the part that might be the biggest pain point for a lot of organizations, and that is medical costs. Every year the medical cost might go up, and once the medical cost goes up, obviously the insurance premiums goes up, and obviously so many other problems can happen. So, and unfortunately, Malaysia in Asia Pacific countries in 2019 had one of the highest increase on inflation rate for medical costs, and that could be a lot of good reasons for it, but maybe one of it could be that we're not addressing the real problem. So this is some of the statistics that I took out. 13% inflation rate on just medical costs, and sometimes in insurance premiums. And you can see Malaysia expects the highest increase in medical benefit costs in 2020, and 15% annually inflation rate is actually quite high, is really high. So for those of you who are Media Express client, you can actually ask Media Express to take out all the statistics from last year. Obviously, you all have it. Outpatient and hospitalization, they take it out, whatever you get this year, plus another 15%, and that's where you're going to be next year if you don't do anything about it. So for your information, one of the things that my team do is that we actually look into your past statistics from claims and from hospitalization, and we give you some suggestion on how to reduce the cost. There is so many ways for you to reduce the cost. One of the easiest way for you to reduce the cost is obviously to try to negotiate better deals with hospital for surgeries, for certain procedures. The second one is get a better deal on medication, and third one is obviously offer some kind of wellness program, so help employees to stay a bit healthier, so they don't have to visit clinics that often, or they don't get sick that often. Mental health is one of the most important part of it. So I'm not going to go more than that. The numbers doesn't look great, but there is a solution, or maybe this is the solution. So in Malaysia's neighboring country, your neighbor, Singapore, managed to drop their medical inflation more than half in only 3 years. What this says is, if you have a plan to address your rising medical cost issue, if you have a plan for 1 month, 3 months, it's not going to help you. You need a comprehensive plan, minimum 1 year plan, 2 year, or maybe 5 year plan. If you have a plan that you slowly follow that plan and you do not stop, you are a lot more likely to get the results you want. It's quite similar to weight loss. If you want to lose weight, right, and you stop eating certain thing for 2 weeks and then you expect a great result long term, that's not going to happen, and everybody knows that. So the best way for people to get better, let's say long-term benefits from whatever that they are trying to achieve is to have a long-term plan and slowly make changes that is not too drastic. So what Singapore did was, obviously they have some health screening they offer, they have some targeted intervention program, which is excellent, health promotion, maybe some awareness programs, they have some online portals and mental health, women's health, and other things. So what can we do here? So now where to start? So obviously there's too much to do as a person who's been working with HR for the past few years. I feel you. I understand what's the struggle. There's too much to do, and there's so little resources. There is so little budget, and there is very little freedom for you to make all these decisions. So, but there are things that you can do. One of the most important things that I feel is missing, which Jess actually mentioned, is intervention mapping. You need to first understand what you're dealing with, and then you have to build a systematic process, definitely long term, to slowly address the problems that you have. If you want to get a better result, you have to have a priority population group and a population needs that you want to address. If you suddenly want to start a program and address cholesterol comes down, hypertension, heal, diabetic, reverse, weight loss all happen, mental health get better, it's not going to happen. So you might need to prioritize and try to go for things that maybe the issues or matters that the biggest problem that your company has, and try to address that, and understand the health problem and what caused this problem in workplace. That's the talk that Dr. Tan did, which instead of just trying to surpass the symptoms, try to understand the reasons behind it. So that is the most important thing. And you might need a multi-level intervention programs, because we deal with people who are not only dealing with one problem. So people who have diabetes, most likely they are obese. Some of them, they might be also suffering from hypertension. They probably have some uric acid problem or high cholesterol problem. They might have asthma. They might have allergies. They might have eczema. They might get sick more. Immune system is weaker. So you might need to build up a multi-level intervention program. And what is actually your best friend is your previous year's medical report. Whenever we look at every company's previous claims and previous statistics from hospitalizations and all the other claims, including medication, it gives us a very clear path on what is the main problems of this population, what they have to do. So one of the first things you have to do is you have to understand a very detailed information about the population. So having a very specific, like at least a basic health screening, lifestyle assessment, mental health assessment is a best way to start, right? Obviously, after you have these statistics, you have this data of all your population, not only population who got sick last year, but whole population, current population. You can specify and you choose a specific target. You can start working on specific methods of behavior changes, and then you can actually put a process of evaluation in place. So you know that as you go in 3 month time, what is your expectation? Where this group's going to be in 6 month time, in 1 year or 2 year or 3 years time? What are you trying to achieve? Again, I go back to what Jess said, which was excellent, and the whole point is system is more important than a goal. The thing is, everybody have a goal. I mean, the person who lose the competition and the person who win the competition, they all have the same goal. Nobody wants to lose. So the goal by itself alone cannot actually change anything. So what we really need to work on is actually the system. And the reason goals are more important, obviously, besides winners and losers have the same goal, but it's also achieving a goal is the only momentary changes. So examples of one of the wider used examples like weight loss. You want to lose, let's say, 10 kilos to get certain prizes from the company because it's a competition. You got the prize, that's it. Then you got no motivation to continue after that. That's it, So that is another problem with just having a goal and not having a proper system that you can continue. You do not rise to the level of your goal. You fall to the level of your system. This is very, very important. If you have a plan to have a wellness program that is amazing in your company, but the system that you gather, you put together these plans is not the right way, it's not the right system, you're not going to succeed. So if you don't have enough data, if you have not researched the methods that you're going to use, if you don't have enough resources, but you don't know about that at the start, so these are the things that can actually give you a big setbacks. Another thing, goals restrict your happiness. So sometimes we are so desperate to achieve certain goals, like let's reduce medical costs this much, or let's get let's say the populations of this population lose weight fast or whatever, and that restricts us, and we just want to wait for that to happen. But the truth is, the moment you start stepping one foot in front of the other in the right direction, you need to feel happy and you need to feel so proud. what HR does is very it can be a very fulfilling job, and you guys have such a big responsibility in your shoulder because you are taking care of maybe hundreds or maybe thousands of people. So that's a very big job you have. That's a huge responsibility. So ensuring the happiness and safety, well-being of these people in place is one of your biggest obviously challenges, and obviously one of the biggest tasks that you have. So putting the happiness first and always looking at what I'm doing next and how I'm going to continue is the most important thing. The next one is goals are at odds with long-term progress. So if your goal is only to do certain thing and you're not thinking on how to continue this process for lifetime, obviously can also possibly put you back where you are, where you started. So that's also another problem with the goal. So let's go straight to the more about intervention programs and all these things. So let's think about the system. This is very important, and I want to communicate it with everybody here because this is the most important thing I'm telling you during this presentation, and that is when you are running a chronic disease patient, you have to make sure that there is a doctor on board. If you are running a chronic disease intervention program, or you want to address chronic disease and you have an intervention and you only have dietitian and fitness trainer, some exercise and some application, please do not do it. Because all the people who are suffering from NCDs, they are usually on medication, long-term medication. And this long-term medication, with changing the diet and changing some physical activities and changing here and there, that can actually significantly affect these patients as a patient, as a person who's suffering from a disease. And it can actually contradict, it can actually make them worsen, put them in dangerous situation. So just being a dietitian there, it doesn't mean you know everything. So if you have any plan for any disease intervention program, you make sure you're having a doctor that is on board and going through every changes that you are trying to implement in these people's life or any behavior that you're suggesting. Okay, why is health screening important? First of all, you need to start somewhere. So health screenings are important for employers, especially for employers, because financially, when people get sick, it costs them a lot. So, but as long as they do some kind of health screening, you might be able to catch some of the disease in a lot earlier stages. So that would help you. When companies provide health screening benefits, which I know a lot of your company already providing that, it helps with the culture of knowing for the employees that employees actually care about them, you know. And also, most importantly, you do a health surveillance, that you know what's going on every year at your workplace. If your company is actually providing this health benefit to the employee, but there is no statistics coming back out of it, and there is no insight coming back out of it, that's the area that you should improve today. Because if you're spending that money, the biggest ROI is just to have the data for the health surveillance. So you know what problems the workplaces have. Obviously, for employees is also a lot of benefit. A lot of employees do not necessarily have enough money to want to invest it on health screening. So if companies help them up in that sense, it would be very helpful for them. It actually gives them a peace of mind. Sometimes you're just being nervous about I might not be healthy, but I don't want to spend that money. So that would give you some kind of stress. So actually having this being sure about your health, that you're a bit healthy, or maybe you have minor problem here and there, that could be actually quite peace of mind for the employees. Also, in some cases, when employees know that they have what problem they have, they might make some small changes, maybe 10 or 15% of the population might make some small changes to try to reverse the condition they have. Let's say if I know that I have high LDL level, high cholesterol, then I would be a bit careful with how much red meat I might be having, or how much fried food I'm taking. So I'll be a bit careful. So purpose of screening, as I mentioned, to understand the health risk, identify opportunities to improve. A benefit plan design needs to be based on the knowledge that you have about the population. You have a target health intervention programs to bring in. If the population shows, let's say, higher risk for obesity, a big portion of population is obese, so that will be your target health intervention to bring up. And then establish a proper baseline, and you can tailor the health management program based on the data that you have. The role of worksite health screening, there's actually a lot. Just summarize it in two things. It's an essential first step. You cannot give any intervention to the population. You know what they're dealing with. We actually had intervention programs previously. I think with the same group we share with Jess, Shafiq, and at one of these telecommunication companies. And first day of exercise session, so many people fainted, and so many people couldn't continue. So if we have not done the screening prior to that, these people could have, we didn't know how to deal with it. So we knew that the heart was healthy. We knew that these people are just a bit under strain. So we just give them some water, we give them something sweet to drink, rest a bit and come back. But imagine if you don't have the baseline and you start with exercises, heavy exercises or whatever exercises, these people cannot take it. And they fall and they pass away, or there's something wrong, something bad happened to them. So then the company is going to be responsible for that. And second one is you want to prioritize what you want to deal with. Sometimes when we don't ask the employee or we don't have the insight about them, we might think this particular company's problem is, let's say, ergonomic problem. But then you look at the data, you listen from the employee, then you understand that no, actually, people get MC a lot because of, not because of back pain, but because of gastritis, for example, right? Or because of migraine. So these are the bigger problems. So if you don't do the surveillance, you don't do the screening, or any kind of screening, can be just a basic, weight and maybe BMI test. So that would actually give you a baseline. It's better than nothing. And also, obviously, lifestyle survey and mental health survey, so you at least understand what these people are doing, how they're living. The role of workshop help, this slide, I will not go through it, but I will send you the slide later. But I want to go back to this one. Do workplace wellness programs actually save money? That's a good question. Jess, are you there? Hello? Jess? All right. Looks like Jess took a break. So, Felicia, maybe I asked you.
Yes, I'm here. Network is a bit
slow.
Yeah, I'm here. Hold on.
I put everybody to sleep.
I'm here.
Jess, what do you think? Do workplace wellness programs actually save employees money? Yes or no?
Yes.
You sure or not?
Very sure.
Okay, we'll go to the next one. But sometimes what our expectations are and what we want to achieve and what we don't want to achieve and all those things is actually quite different. So this is very important. There are two types of wellness programs that you run in your company. One is a lifestyle management program, which you concentrate on, let's say, smoking, cessation, on obesity, weight loss program, nutrition, and all those things, which targets people's lifestyle program. And you're looking at the return on investment in a long term. So if people now they're healthy, they take care of their health, in long term, they won't get sick. So that would be your ROI, which I'll go through it, which one's better. But then second one is a disease management program. This program is set for people who are suffering with chronic disease, people who are having diabetes, they have high cholesterol, they have, let's say they have different kind of allergies, they have gastritis, they have so many, maybe cancer. So when you have a disease management program, you're actually, your system is put in a place to help these people to manage the diseases better. So this is the program that you need doctors. This is the program that you need to be very careful. Every individual is going to be different. Any medication that they take is different. But if you manage to do this program right, it gives you the highest return on your investment. So if lifestyle management program, which is widely used in Malaysia, almost maybe 90% of all the companies are concentrating on lifestyle management programs, and then your return on investment is 50 cents on every dollar that you spend. The rate of return for disease management program, means help people who are sick to get better, is $3.8 per $1 spending. Helps a lot. So this is the diagram, yeah. So you see on top is disease management program. So you help people with heart disease, diabetes, and all this problem. Short term, you can get the result. You can significantly see the differences. The second one down there is lifestyle management program, which is a shoe photo there. So you help them with poor habits, smoking, and lack of exercise. In long term, you will get the result. You can bring down the chances of them getting these diseases. So in one population, in the particular study that I used here, I will share it with you, so you might be able to use it later on and read through it. It's an interesting study. Out of 100% of population, 87% were on lifestyle management program, and only 13% were on disease management program. But the rate of return on the 13% of population who had disease management programs were 87%. That means even though smaller portion of population which already have the disease come on the program, on disease management program, they can generate the biggest portion of the revenue for the company. So the first thing you do, concentrate on people who are sick. Help them out. Don't let them get worse, because these people can get worse. So that's the first step to do. So in total for this study, for disease management program, $3.8 per $1 spent, and for the lifestyle intervention program, only 50 cents per $1 was saved per member per month for this particular organization, which in average was 1.5. So you can see that there's some return on it. So this might help you to, this potentially can help you to speak to the management. Maybe you can convince them to do something for people to help them out. Workplace health programs can impact healthcare costs. Yes, so I would provide this to you. The thing is, there's so many studies, like for this particular one, it's 56 published studies. They concluded that 25% saving from with providing wellness program at workplace, you can actually save about 25% on absenteeism, on some medication costs and all those things. Second study that I looked at was Duke University. Also some saving, $1.21 for $1 spent, and $3.39 for $1 spent on cholesterol intervention program. And Johnson & Johnson, they have different one, and they actually concluded that approximately $225 per participant employed per year was saved for the company. So I will send this to you and you have a look. I think this is almost the end of my presentation. I will send you these studies. This is a photo of what I explained to you. You can achieve the best outcome if you put together a screening and intervention together. Screening alone, intervention alone, it doesn't help you much. You need to put them together to be able to achieve better ROI and get better results, obviously in long term. So I just show you some examples of wellness initiatives, that some of it we've done it. This is done by us. So obviously you can do health screenings on site. Benefit for health screening on site is obviously higher utilization. People do not want to go sit outside in clinic and hospital half a day, take leave and all those things. So on site increases the utilization. Also, you can get a better rate on each screening packages, and also you can get the statistics and reports and have data of your employees. Do on-site immunization. We went through more than 10 different companies in the past 2-3 months alone for this year. We went through the statistics and highest number of claims for each diagnosis. And surprise, flu and cold and upper respiratory infection, all those things related to this flu virus and all those things is the highest claim that everybody is paying, and you're paying so much money for that, and you can pay a lot less of that and bring maybe some companies in to help you do flu vaccination, pneumonia vaccination, HPV, hepatitis, do typhoid, depending on what the job scope of employees are. Do immunization. It saves you a lot of money, and also helps with reducing NCs. It helps with so much. So even presenteeism, when people are sick, maybe when they have flu, they stay home 2 days maximum. But the flu is in their body for 2 weeks, so they won't be such a very productive individual, obviously. Outdoor activities are free. Just organize them. Go out. Water bottle selfies, or all different type of gamification plans that you can have. I think Felicia is going to go through a lot other suggestions for that. So please tune in for that talk. It will be interesting. Take our nutritionist. That's actually Felicia over there in front with a happy face. Yes. So grocery trip with nutritionist. It's very fun and it's so important. People go for grocery trips and they don't know what big mistakes they're making with buying the wrong thing because they have the wrong perceptions of different foods. Please fix your cafeteria. If this is your cafeteria, there is nothing any wellness provider can help you with. There's nothing, because that's what they eat. There's nothing anybody else can do. So fixing cafeteria might be like the first thing you want to actually do in terms of making changes in the environment. And thank you very much for your time. I hope I didn't take too long.